My name is Dr. Beatrice Ige.
How are you?
I am the medical director of Brich Aesthetics Clinic located here in Ikoyi, Lagos, Nigeria. Today we're going to be talking about everything skin. One of the misconceptions people have about skin is, do I have to continue doing this particular thing for a very long time, or is it just a one-off treatment? And nothing about the skin is one-off, because the skin is the largest organ in the body and the skin needs to be taken care of. But the skin, like every other system in our body, needs consistency, and without that consistency you will not achieve any result. If you have acne, yes, acne is a chronic inflammatory disorder, meaning it's almost kind of lifelong, and you definitely need to keep up with your treatment or your products or whatever you're doing to help the acne, and also lifestyle modification. The most common skin challenge is still and will always remain acne and hyperpigmentation. Recent trends have shown that because of the age of selfie filters, people now want to look a little bit different from what they usually perceive themselves. So we're seeing more of people going into facial contours, fillers, rhinoplasty, more of cosmetic surgery. But acne and hyperpigmentation still remains the highest skincare problem. Today we're going to do a procedure on a patient who has mild, or I would call it more of a moderate acne. She's been doing a series of treatments. So yes, her acne has been suppressed, so much more. But the reason why we're going to do this treatment is because even if she's using products, we're trying to increase the immunity of her skin cells and trying to suppress the acne formation. So rather than doing just, typical facial, I'm going to inject some peptide-like treatments into her skin directly. We call it mesotherapy. Now, after doing that, we're going to put a light superficial chemical pill on her skin to kind of seal up the area. And these are specialized treatments, and I only do it on specific patients because of maybe their history or, the line of treatment we want to go into. These treatments, you can't see them in just a typical spa or in a typical, esthetician would just carry out on you. Because while I'm injecting, I have to be careful of some certain nerves, blood vessels, and some certain areas where these particular drugs are not supposed to be injected because they can further cause other damages to some of the other underlying structures on the face. But what she will tell you today, she feels a big relief after doing the treatment, and her face will look a bit more glossy and glassy afterwards. There are a few things I would tell people in Nigeria, black skin, not to do. One, try to stay away from plastic surgery of the face, because African skin, black skin, tends to be prone to keloid and hypertrophic scarring. And for some people, they say, oh, I'm not keloid prone, but the hypertrophic scars don't go away. So the second thing I would usually stay off is too much facial fillers. I mean, though you want to have an augmented face, and some people feel that they want cheekbones or more contouring, we tend to have bigger, wider face here in Nigeria, and too much fillers will only make us look puffier and older, not youthful. And the third thing is stay away from too much skincare products. I notice a lot of women out there, they mix so many products together, and they don't realize that the mixture of these products is causing their skin more harm than good. A simple skincare routine, it still goes cleanse. Now, some people say double cleanse, some people say triple cleanse, but the whole idea of the cleansing is to make sure that your skin is thoroughly cleaned. Now, if you have excessive makeup, you might have to double cleanse your face. And if you have no makeup at all, or you have dry skin, just cleansing your skin one time could be okay for you. And then the second thing is to tone. Toning is just prepping your skin for your serums and your moisturizer. Some people have sensitive skin, so you might tend to cut down on the toning. You might not want to always tone the skin. You might just want to leave it black because you don't want those harsh skin toners on the skin because they kind of create more sensitivity. And then the next thing, very simple, is to lay down your moisturizer. And after the moisturizer, you can lay down your sunscreen, which is the last thing you place on your face because it will protect you from ultraviolet light rays A and B. And that's for aging and for sunburn. If I was to say what someone should do for acne, is go and see a doctor. Acne has grades. You have mild, moderate, severe acne. You cannot treat severe acne the way you treat mild acne. Just because it looks like acne does not mean it's acne. And therefore, you need to see a specialist so that a proper diagnosis can be given.